CAM, complementary and alternative medicine, as well as holistic medicine, have become pretty popular terms, but they often can have negative connotations and not be so respected in mainstream medicine. But what is CAM really?
Yeah, it's a good question. People get this confused all the time. It depends on what you're talking about. If you're talking about things that are new in medicine, that would be new things that are coming into the mainstream, like conventional research. That probably wouldn't be complementary and alternative. When you're looking at other disciplines, things like Chinese medicine or acupuncture or Ayurveda or Native American medicine or energy medicine, those are things that are not really readily accepted in the mainstream. And that term often gets confused, Vicki, with the term integrative medicine, which is really looking at different styles of medicine like I just described and working together. And then there's the third thing, which is called holistic medicine. And most people get that confused with something that's just alternative. But actually, holistic means looking at the whole person.
Body, mind, emotion, and spirit.
Yeah, so why wouldn't you want to look at all those perspectives when you're evaluating a patient? It only makes sense, doesn't it?
So you can ask yourself, why is the public demanding it? And are hospitals and clinics often claiming to incorporate it into mainstream medicine because they really support it or because it'll draw more patients to the hospitals and those clinics?
You got it. It's exactly about that. It's about trying to bring in more business because hospitals, quite honestly, a lot of them have alternative medicine programs, but not in the hospital. They'll have them as outpatient clinics, but they won't let them step inside the doors of the hospital. That experience happened to me when I was at a local hospital, and I needed to have Chinese medicine with acupuncture for an unusual thing that I had, and it just wasn't possible. So we had to bring in our own people, close the door, and do it behind closed doors. So it's definitely about business. It's about turf wars. So while they want more business, they want to appeal to the public, and the public is the one that has a demand for something other than what they're getting today, because medicine's starting to get the bad rap that it deserves, because it's not the only way to do things, and a lot of it doesn't solve the problem, as we have this epidemic of chronic diseases that we can't afford, and the safety has been called into question.
Well, there was a news release that just came out that shows that the military is open to doing research on CAM as a substitute for prescription drugs in treating post-traumatic stress disorder. But do we really need more money spent on research to show that meditation and acupuncture and body-mind work and chiropractic and nutrition and all of that can be good for our health? We already know that.
Yeah, absolutely. You're right. The problem is that the people who are in the mainstream that are doing mainstream therapies don't want change. Change means you're going to have other disciplines replacing yours a lot of the time.
Well, they want you to take the drugs, too.
Well, that's where it boils down to, because that's the mainstream and where all the money is.
But the patients aren't wanting the drugs.
Well, they'd rather not have drugs. They'd rather have something that is like what you just described. Why not do a little acupuncture or do some body work or do some kind of relaxation therapies or meditation?
Work on your lifestyle.
Yeah. I mean, there's a doctor, an MD, who does acupuncture. His name is Joe Helms, and he works with the military using Chinese medicine, but mainly using acupuncture. And in our personal conversations, he told me that it works quite well, and that this was something that everybody was liking. The patients liked it. The other doctors were respecting it. And yet we've got a situation where it's still not really taking hold outside of the mainstream.
Well, you know, we all know that meditation can be helpful for anxiety and depression and suicidal thoughts. I mean, it's not a secret. But so now we're going to be required to do more studies to prove it?
Well, yes. I mean, I understand science-based approach to medicine, but I mean, that's double talk. Science-based, really? I mean, who's doing the research? It's the people who have a conflict of interest and want a certain kind of technology or drug to be brought into the mainstream. And when the Office of Technology Assessment looked at all this, they just kind of laughed and said, well, medicine maybe has about 15% of good science in it, and it has even less when you're looking at the research. They said something like 1%. And when Marcia Angel, who was the doctor, who was the chief editor-in-chief of the New England Journal of Medicine, probably the most prestigious medical journal in existence, who's an MD and from Harvard, was working there for a number of years, finally said, I'm quitting this job because I can't stand the low quality of information that's coming across my desk and getting into the journal. So we have a real problem here that really tells us that it's money that's running everything.
Yeah, and getting back to the military, that
Yeah.
would be money too, because when you think about it, all these boys that have gone to war, well, we should call them men, that have gone to war and been in combat, they all have PTSD.
Yeah, how could
they
you
have
not?
to.
And yet the military is, the VA is saying, well, maybe 20% have a problem with that needs to be treated. But see, they have financial problems too. They don't have enough money to treat all the vets. And that's why you're seeing so few of them treated, and why we're seeing the extreme cases who are homeless people on the streets of San Francisco, where we live. I mean, it's a terrible
But it
thing.
makes more sense to try CAM first before you go to prescription drugs.
In this case, it absolutely does.
But this is what's happened, is that the patients don't really like taking the drugs, and they're finding that the drugs aren't really helping.
Well, they don't work
so
that much.
now they're turning to CAM, but they should be doing it in the reverse.
So if you had PTSD, what would you want? You'd like to have the safest treatment that works the best, and you wouldn't care if it was a drug or it was hanging by your toes. You want to have the best thing that works. But in today's medical paradigm, it's not like that. The status quo really rules, and the people who have the most money that are in the status quo are spending it to try and keep things just the way they are. So when we're looking at complementary and alternative medicine, holistic medicine, or integrative medicine, it's pretty straightforward that if we use more approaches that are common sense and we try them, we're going to be ahead of the game. And we don't need a whole lot of research to do that. Research is good, but usually it has conflicts of interest, and that takes away from it.